Oh, thank you very much, Professor, for such a nice book. This is our guest, Professor Mohammed Hamid. This is his book, and he gave us a really nice talk about his results with intratympanic therapy of inner ear disease, especially Meniere's disease. Professor, please tell me more about how often do you perform this procedure, and after what do you tell me, 3,000 or 4,000 intratympanic installations, did you ever have any side effects?
All right. First of all, I would like to thank Dr. Dusan Pavlovic for his kind invitation. I'm very honored to be here. It's my first time in Belgrade, and the meeting is wonderful. I do perfusion practically every week, and we have no major side effects of this treatment. It's the most effective treatment for people with Meniere's disease, and I'm very happy to see you doing this treatment here in Belgrade, as well as other physicians.
Oh, thank you very much.
Yeah.
So you have very good results, I saw, in controlling vertigo in the patients with Meniere disease.
Yes, we control the vertigo, we recover hearing as well, and for tinnitus, there is 60 to 70% of the time improvement as well.
Oh, yes. And please just tell me about your results with the patients with sudden sensory neural hearing loss. Do you use the same approach, same treatment?
We use the same approach. If it is sudden hearing loss in Meniere's disease, the results are much better than the viral idiopathic sensory neural hearing loss.
Okay, thank you very much.
Anytime. Thank you again.